Hello, it's me, Princess Grace Cortado, your student midwife, and as for today's video, I'm going to have my health teachings about the third trimester bleeding disorder. Third trimester bleeding can range from spotting to life-threatening hemorrhage. So the objective of this video are to list the causes of the third trimester bleeding, describe the initial evaluation of a patient with third trimester bleeding, differentiate the signs and symptoms of the third trimester bleeding, and to list the maternal and fetal complications of placenta previa and abruptio placenta. So the common causes of the third trimester bleeding are placenta previa and abruptio placenta. Note that these causes can lead to serious neonatal and maternal morbidity and mortality. Remember to always assess the fetal heart rate status as part of the initial evaluation of the third trimester bleeding. Once you're assured that the client is stable and there is a reassuring fetal heart rate pattern, then a careful history should be obtained. Then move on to the physical examination. Look at the maternal vital signs. Again, remember to assess the fetal heart rate. Ensure that there is a good IV access if you are concerned about heavy bleeding. Palpate the uterus to assess if it is soft, hard, or tender. Remember, do not perform cervical examination until the placental location has been confirmed. Let's now discuss placenta previa. Placenta previa is a condition wherein the placenta of a pregnant woman is implanted abnormally in the uterus. There are three types of placenta previa: the marginal, complete, and low-lying previa. Placenta previa is dangerous if not detected early. However, it is also highly preventable once you get to know the risk factors. This includes the advanced maternal age, multiple gestations, increased parity, past cesarean births, and past uterine curettage. The signs and symptoms are bright red bleeding and painless vaginal bleeding. Also, placenta previa is diagnosed by an ultrasound. Remember that with the placenta previa, a digital cervical examination should not be performed, for digital manipulation can cause bleeding. If there is heavy bleeding, do resuscitation and possibly betamethasone for fetal lung maturity. Delivery with the placenta previa should be performed via cesarean section. Adverse maternal outcomes associated with it were postpartum anemia and the need for blood transfusion. Neonates born from placenta previa women were also risk of being born preterm, intrauterine growth restriction, and respiratory distress syndrome. Let's now discuss abruptio placenta. It is the premature separation of the placenta that occurs late in pregnancy. Common signs and symptoms is dark red vaginal bleeding with abdominal pain. The following are the risk factors that surround abruptio placenta. This includes high parity, short umbilical cord, advanced maternal age, and trauma. The diagnosis of abruptio placenta is by clinical examination. The management for abruptio placenta involves monitoring of the vital signs, fluid administration, close monitoring of fetal rate pattern, and delivery for severe hemorrhage.